I think one of the major reasons for vaccine hesitancy is the misinformation that is out there. And I know there's been a big push by especially pediatricians to do a lot of education with the parents, with primary care providers, to talk to the elderly about what vaccines are recommended for them. But in the age of social media, a lot of information can spread very quickly, whether it's accurate or not. So I think that is contributing to people's vaccine hesitancy. I also think after the COVID vaccine, people got very concerned about vaccine development and had a lot of questions about it. But I think the important thing to do is to listen to your medical provider. And that's what they do. That's what they're trained in, to provide medical advice about infection control via vaccines.
Thank you for listening to the HOCO Health Podcast, a podcast produced in a collaboration by the Howard County Health Department and Howard Community College, where we discuss topics on all things public health. I'm Howard County Health Officer Dr. Maura Rossman. During today's episode, we're exploring the world of infectious diseases. Infectious diseases have been part of human history for as long as we've existed. These are illnesses caused by harmful organisms such as bacteria, viruses, fungi, or parasites. They can spread directly or indirectly from one person to another, and some can even be spread by animals or the environment. Understanding these diseases is important to keeping our communities and families safe and healthy. One of the key aspects of public health is preventing the spread of infectious diseases. Public health professionals work to monitor outbreaks, develop strategies to control them, and educate the public on how to protect themselves. This includes everything from promoting good hygiene practices like hand washing and vaccination to more complex strategies like quarantine measures and travel restrictions. Let's look for an example like the common cold. It's caused by viruses that spread easily, often through coughing and sneezing. While it might seem pretty minor, colds can spread quickly and lead to more serious health issues, especially for vulnerable populations like the elderly or those with weakened immune systems. Public health measures, like encouraging people to stay home when they're sick and hand hygiene, help reduce the spread of colds and other illnesses. Other infectious diseases include the flu or influenza. The flu can be much more severe than the common cold and can lead to serious health complications and even death. Each year, public health agencies work to develop and distribute flu vaccines to protect as many people as possible. This vaccination effort is a cornerstone of public health, aiming to create herd immunity, where enough people are immune to a disease, its spread is less likely. Recently, we've seen the global impact of infectious diseases with the COVID-19 pandemic. This virus spread quickly around the world, challenging public health systems and highlighting the importance of preparedness and response. Public health measures like social distancing, mask wearing, and vaccination campaigns have been critical in managing the spread of COVID-19. But public health doesn't just react to outbreaks, it also focuses on prevention. This includes routine vaccinations for diseases like measles, mumps, and rubella, which have become rare in many parts of the world because of effective immunization programs. But recently, we're seeing a resurgence due to limited uptake of vaccination by some people. These vaccines protect individuals and contribute to the overall health of the community by preventing the spread of disease. Surveillance is another critical part of public health. Surveillance involves tracking the occurrence of diseases, identifying outbreaks early, and understanding how they spread. Data analysis is critical for disease surveillance. It allows for quicker and more accurate responses to outbreaks. Infectious diseases can have social and economic impact. Outbreaks can disrupt daily life, strain healthcare systems, and affect economies. Public health efforts aim to mitigate or reduce these impacts by promoting health equity and ensuring that all communities and individuals have access to the resources and information they need to stay healthy and thrive. Today, we're in for a treat, as always. We are going to talk to two of our resident experts in infectious diseases. Dr. Kelly Russo is the health department's medical director. She is responsible for providing guidance and support to the infectious disease team. She also works closely with community partners, medical providers, hospitals, and other public health agencies to control infectious diseases. Ms. Jamie Korick is the Infectious Disease Surveillance and Response Team Supervisor in our Bureau of Infection Control and Public Health Readiness. All right, Dr. Russo, welcome. Tell us what progress we've made in public health in the field of infection prevention and control to improve our everyday lives compared with 25, 50, and even 100 years ago. Basically, we're saying what's been going on for 100 years and how has public health improved our lives?
Thank you so much, Dr. Rossman, for having me. I'm excited to be here to talk about all things infectious disease and control related. So a ton of progress has been made in the field of infectious disease control. I might be a little biased, but I think one of the biggest impacts to infection control was the establishment of health departments back in the early 1900s. It sort of allowed for a very coordinated response to infectious diseases to help prevent, control, and mitigate the effects of different infections. On top of that, I would say vaccination over the years has been extremely important. The first vaccines that were licensed, that was back in the early 1900s with pertussis, tetanus coming to mind. Vaccines are extremely effective both in preventing disease and also decreasing the severity of illness. So very important. Another interesting one I would say is testing. So the ability to do certain tests for infectious diseases, it's not only identifying the cause of someone's illness, but it also now, in the last 2 decades or so, allows us to actually look at the genetics of different organisms to see whether or not they match. Are they the same strain? Which is important for us because that sort of alerts us to, hey, these are the same strains. Could there be some sort of outbreak happening? Is there a link between these people? So I would say those are the biggest contributors to where we are right now with infection control.
And you reminded me that Howard County Health Department is coming up on its almost 100th anniversary. So local public health, even in the state of Maryland, has been around for a very long time, contributing to improving the lives and longevity of our residents. And I totally agree. I think our listeners may know I'm a pediatrician. One of the bread and butter activities of pediatricians is to promote and offer vaccination to our youngest residents. And certainly the advent of vaccines has contributed both to improving the health and longevity of our lives. So, just talking about vaccines, we do hear a lot, and I do hear parents have questions about the safety and efficacy of vaccines. Can you talk a little bit about why some people may be vaccine hesitant and how lowering when we have fewer people vaccinated, actually that can contribute to more outbreaks?
Sure, that's a great question and very timely given the post-COVID vaccine era now. I think one of the major reasons for vaccine hesitancy is the misinformation that is out there. And I know there's been a big push by especially pediatricians to do a lot of education with the parents, with primary care providers, to talk to the elderly about what vaccines are recommended for them. But in the age of social media, a lot of information can spread very quickly, whether it's accurate or not. So I think that is contributing to people's vaccine hesitancy. I also think after the COVID vaccine, people got very concerned about vaccine development and had a lot of questions about it. But I think the important thing to do is to listen to your medical provider. And that's what they do. That's what they're trained in, to provide medical advice about infection control via vaccines. So you mentioned this in your intro, but the concept of herd immunity, or sometimes called population immunity, is huge. So vaccines kind of work in two ways. One, it protects the person, the individual. It will prevent me from getting measles, let's say. But when you have a community with a large number of people in that community immune, either by vaccine or natural infection, that decreases the likelihood that transmission will occur, because there's a lack of the ability for the virus, the bacteria, whatever it might be, to spread, because you have so many people that have some immunity to whichever organism it is.
Right. So you can try to protect yourself or develop immunity, right, by natural immunity when you get the disease yourself, or by the use of vaccines. And yeah, I agree. Sometimes I think people are receiving confusing information regarding vaccines in particular. And I do encourage everyone, if you have vaccines, certainly go talk to your medical provider and get quality information so that you can make the best decision for yourself and your family. I often get asked by people, they know or they hear about me talk about vaccines and totally agree how it's a basic principle of public health and has saved lives over the past 100 years. But what are some other ways that people can protect themselves from infectious diseases?
That's a great question, and there are quite a few ways. The first one is to get vaccinated. We know the vaccines that are out there are very effective, and they offer protection, again, not just to the individual, but to the community. The other thing to do is to try to avoid close contact with people who are ill. That will decrease the likelihood of transmission if you're not in close contact with them. Good hand hygiene. So we say, wash your hands, wash your hands, wash your hands. That works for a lot of different infections. So please continue to do that. If it's respiratory illness that you're concerned about, or you're around someone who's sick with a respiratory infection, to use a face mask. And you really need to be aware of risk factors for specific diseases. So, for instance, protect yourself against tick bites by wearing appropriate clothing if you're in that sort of environment. Wear insect repellent if, we're trying to prevent some mosquito-borne illnesses. If you're trying to prevent rabies exposure, don't touch stray dogs, don't touch wild animals. Use safe sex practices to prevent STIs or sexually transmitted infections. Make sure you prepare food appropriately. And I always tell people when you're traveling out of the country, make sure that you look into what infections might be in that specific area and educate yourself about that. Talk to your medical provider about what other precautions need to be taken.
Yes, that's a great point, right? Because different infectious organisms live in different climates and different environments. What may be happening here in North America may be very different than what's happening in the Southern Hemisphere, for example. The other thing I know we've talked about in other podcasts, these things that you're talking about are the non-pharmaceutical interventions to prevent infectious diseases. But the other thing people can do, right? Eat well, sleep well, get physical activity, and just try to remain as healthy as possible. Because the question for you I have, Dr. Russo, is some populations are more vulnerable than others. Why is that?
That's another great question. So, first and foremost, it really has to do with the function of people's immune system, right? So, how well is your immune system able to fight infections? And there are a couple of different categories to look at. One is age. So, the very young and the very old are more susceptible because their immune systems don't work as well as people who are sort of in that middle ground, which is why there are specific recommendations for vaccines in those two ends of the spectrum populations. We also have to take into account chronic diseases that people might have, diabetes, chronic kidney disease. Those can all affect the immune system. Then looking at directly weakening the immune system with medications such as cancer treatments, people with transplants, they have to take specific medications. Rheumatoid arthritis, psoriasis, they take specific medications to weaken the immune system so their disease can be treated, but it has this adverse effect of then making you more at risk of getting an infection. So it all has to do with the immune system in some way, shape, or form. And a lot of this is not known. The exact mechanisms for some of these are not known, but we do have a pretty good handle on which groups are affected the most by which specific organisms.
Right. So great points. So it's important, obviously, to understand your vulnerabilities or immune system and other factors that may make you more individual than not and want to protect yourself, but also with whom you live with, right? Sometimes you're getting vaccinated, maybe not primarily to protect yourself, but protect someone else in your house so that you don't inadvertently transmit an infection to them. So, good things to think about. Well, great discussion we're having, Dr. Russo, but we're going to switch a little bit so we can talk to Jamie Couric. But before we do that, we're going to take a break and we'll come back and talk to nurse and infectious disease specialist Jamie Couric. Infectious diseases with our medical director, Dr. Kelly Russo, and infectious disease surveillance and response team supervisor, Jamie Couric. Let's talk to you, Jamie, about your work with infectious diseases. You do some pretty specialized work that not everyone may be familiar with. So tell us a little bit about some of the common infections that occur in Howard County and some that may be seasonal.
Sure. First off, thank you both for having me here today. It's an honor to be participating on this panel with such respected leaders that I get to work with every day. And some of the things you're talking about with infectious diseases, In my role of surveillance and response, we monitor diseases and when they occur through our day-to-day work. So something that becomes prevalent in the summer months, which is one of my favorite seasons because we get to get outdoors and soak up sun and do all kinds of fun activities. But we notice a lot of tick-borne diseases because you're outside, maybe going on hikes where there's that potential exposure to an insect that can transmit diseases. So with that knowledge from the surveillance aspect, we can take the appropriate prevention measures and wear long sleeve clothing if I'm going to go on a hike, or wear the bug spray to prevent being bitten.
Well, thank you. I bet a lot of people now they know that the health department is collecting lots of information from different sources on reportable and sometimes non-reportable diseases. Can you describe the role of your team in preventing and responding to these disease threats?
Yeah, I don't think a lot of people realize that the state sets out a list of over 80 diseases and outbreaks and incidences that they consider reportable. And those are things that my team monitors for because the state's watching for that data. We want to see when there's increases or decreases in those incidences of disease. So my team every day takes that list of reportable diseases and we use the Code of Maryland Regulations, often nicknamed COMAR. And that law enables us to work with healthcare providers, hospitals, laboratories, schools, childcares, number of partners in our jurisdiction and community, where we rely on people reporting to us that there's a illness, that there's something of suspicion or something that's different, where then my team can do an investigation. We can look at what is the disease, what is happening, how is it spreading. Once we determine the potential source and how it's spreading and who is more susceptible to illness, then we can take action to protect the public health in our community. That may be through providing resources, that may be doing contact tracing and offering vaccines to those that have been exposed. So we have numerous ways every day that we do that. We use outbreaks, we do singular case investigations, we go into facilities and do site visits and education. We partner with programs in Howard County for food, illness, and rabies. So we have lots of different pathways that my team can navigate each day, and it keeps every day of my job exciting.
It's true. You never know what what disease is going to pop up. So, going back to the beginning of our discussion here, we were talking about, some of the things about the past 100 years of public health that have contributed to the health and longevity of our community. And I would include, you used one of the terms, contact tracing and disease surveillance. And I would also add that those two strategies really have also contributed and are basic tenets to public health. And certainly over the past 5 years, some of these words the publics have heard a whole lot that maybe they didn't hear before, like contact tracing and isolation and quarantine. But in fact, your team, that's just common words and lexicon that you use every day. So in thinking about that, can you be a little more specific and share with our listeners examples of some of your recent or notable investigations that your team has worked on and completed?
Sure. There's so many of interest, but when asked, I think a great example that comes to mind was a recent salmonella investigation. And that comes to mind personally, as I was mentioning, summer months being some of my favorite seasons. And a lot of people are outdoors where cookouts have food being left outside as you're enjoying the sun and playing cornhole with your families for hours on ends. And people may become ill unknowingly. And my program can find a Salmonella laboratory report through a National Electronic Disease Surveillance System, nicknamed NEDS, where someone got a illness and diagnosed with a Salmonella positive report, that needed to seek treatment in the hospital to get better. And once the patient was feeling well enough, my team completed a case investigation, which includes completing a case report form that's lengthy, collecting demographic information, medical history, foods that were eaten, activities that were done in the days leading up to the illness, so that we could try to see, did this happen at a cookout or did this happen at a restaurant? And it takes experience doing this, where my team was able to pick up on a potential source at a restaurant. And we were able to partner with our Howard County food program and let them know that we had this suspicion. And then they went and did their job of inspecting the restaurant and seeing if there was a cause that could have led to that person getting ill. And then that's how we get the satisfaction of protecting the public. And as a nurse, you know what, you want to take care of everybody. And this is such a joy to be able to connect and potentially protect many people. As we investigated, we found a potential source. We worked with a partner organization within Howard County, who then went and protected many by making the necessary corrections to prevent others from getting ill.
You're right. I mean, salmonella is a great example of a foodborne illness that can occur any time of the year, right? And you also mentioned, at least in this case, a restaurant was involved. I always tell people I live in Howard County and we like to eat out a lot. And it's very important that the places we go are cooking our food safely and in accordance to regulations. And just like people may not know that your fabulous team exists, we also have a fabulous team of environmental health specialists who are inspecting our restaurants on a routine basis, but then also when your team notifies them, and they can go out to the restaurant, find out what's going on. If there are things that need to be improved, they educate the restaurant staff on what needs to be improved, and take samples, and rarely, sometimes we'll even go as far as having to close a restaurant to protect the public health until the restaurant can do the things that they need to. So great example of that. And for our listeners, salmonella food poisoning can cause generally a variety of different symptoms, but includes gastrointestinal vomiting, diarrhea, fever, and some people, most of the time it gets better on its own, but some people, as Jamie said, can get quite sick and have to be hospitalized. So let's talk about back to like sort of vulnerable populations. We were talking about vulnerable populations with Dr. Russo. How can these groups protect themselves from potentially dangerous illnesses so they don't wind up on your list?
Howard County Surveillance and Response Program recognizes that vulnerable populations, elderly individuals, are often living in long-term care facilities. We know that in that setting, there's potential for transmission of diseases. We know that, as Dr. Russo mentioned, with their advancing age, they may have complicating chronic diseases, and their age puts them at risk for acquiring those diseases in that setting. So the things that they can do is, as mentioned, talk to their medical provider about vaccinations that are available to those in their age group. And then us, as a surveillance and response program, we look at the data and see what education and prevention we can do. The biggest goal of ours is to prevent them from even getting the disease where we can. So our team has actually launched a site visit initiative. We developed relationships during COVID as we were all navigating that time. And we wanted to continue that into our day-to-day work and be a resource for providing facilities with guidance to navigate all that they do and give them infection prevention and control education so that they can prevent the disease to those vulnerable.
Exactly. So talk to your provider, again, vaccination, the non-pharmaceutical interventions that we mentioned, and even your favorite time of year. You talked about summer cookouts and whatnot. All of us, when we're cooking our food and preparing our food, there are certain things that we can do to make it as safe as possible, like cooking it to a certain temperature. When it's 100 degrees outside, probably not a good idea to have your chicken salad sitting out for an hour or 2 hours, but all those type of things that we can be thinking about to avoid or prevent infection in the first place. So we've been talking about what your team does within the health department and partnering with our environmental health specialists. But what other partners do you work with outside of the health department to limit the spread of diseases in our community?
We work with just about anybody. We work with, as mentioned, long-term care facilities. We work with hospitals, K through 12 schools, private and public, detention centers, homeless shelters. We work with Maryland Department of Health, Centers for Disease Control, CDC, other local health departments. And it can happen in any avenue of different ways. There may be a case, say, of rabies. Someone was exposed in our county, but maybe the animal's in another county. So we work with the other local health department to partner and work to protect the person through that exposure and prevent others until we understand that the animal is safe. So any number of even general community is welcome to call and talk with us, and we can try to answer their questions and give them the best guidance and provide them with supportive resources.
Well, believe it or not, our time is up. I know we could go on for quite a bit more. But Jamie, can you just share with our audience if someone wants to get in touch with your team because they have a concern about an infectious disease, how would they contact and who would they contact?
They can call our program. The phone number is 410-313-1412. Or we have a program email, which is infectiousdisease@howardcountymd.gov.
Well, thank you for that. And thank you to Drs. Russo and Nurse Jamie Korick. Unfortunately, we are out of time. You can stay up to date with what's going on at the health department by following us on social media at HOCO Health. And you can also listen to all of our podcast episodes at hocohealth.podbean.com, on Spotify, or whatever else you listen to find your favorite podcast. Thank you for listening to the HOCO Health podcast. We hope you will join us again for a new public health topic.